I'm again representing on behalf of Delaram. Delaram is a student who did the main bulk of this work with Yekta, who is a psychologist with pharmacy background. And for this project, we asked Dr. Lars French, who is expert in inflammation and based in Zurich, to review our data, and also Michelle kindly accepted to help us with the study. Basically, it's inflammation and depression. Which one is the chicken or the egg? What is the link between these two conditions? We know that the prevalence of affective disorder, such as depression and anxiety, are particularly high in inflammatory skin disease like psoriasis, atopic dermatitis, and hidradenitis suppurativa. And patients that have chronic inflammatory disease have lower quality of life, more psychiatric burden in compared to other debilitating disease that they don't have this inflammatory component. Then the question, sorry, we learned one and then it was changed again. That was right? Yeah. Okay. Is there a link? The high rate of depression and anxiety in these patients may be due to living with a debilitating disease like HS that we all know how these patients are suffering, or there is another side of the coin that could be another explanation would be that the physiological consequence of a chronically elevated inflammatory cytokines are contributing to mood and cognitive change in these patients. Hidradenitis suppurativa, IBD, rheumatoid arthritis, atopic dermatitis, and psoriasis are part of disease that are well studied over the last few years because of new treatment. And we hear more and more that these patients are suffering from depression and anxiety. And what is common in all of them is inflammation. And inflammation, higher inflammation with higher severity of the disease. And higher depression and anxiety. Then the objective of this review and study that we did was to discuss the role of inflammation in depressive symptoms that we see in these conditions, including HS, and look at the 5 years literature that is related to this topic. We know that the link between HS and psychiatric burden, it's more larger data shows that this is a new study that showed at least one psychiatric condition has been seen in patients with HS in 24% of cases, comparing 4,000 patients with HS with 40,000 psoriasis and 40,000 epidermal nevus, another condition then, and while this rate is in psoriasis is 19% and in epidermal nevus is 13%. Plus we have higher schizophrenia, rate of schizophrenia and bipolar disorder in patients with HS. Another study from Israel, Dr. Shavit, who is here, they did this study up to 40% with a patient with HS, they have up to 40% depression. Then our hypothesis is depression and psychiatric symptoms in patients with HS is byproduct of dysregulated inflammatory response and disease symptom and severity. We did a literature search over the last 5 years with keywords of inflammation, depression, mood, psych, and 3 diseases of atopic dermatitis, hidradenitis suppurativa, and psoriasis. Came up with 240 articles, in total 273 articles, and we excluded from this group 46 atopic dermatitis, 112 psoriasis, and 16 hidradenitis. And we reviewed the abstract, came up with 42 relevant papers and included in our review. what is clear in the literature is that there is a considerable evidence showing elevated level of TNF-alpha, IL-6 in patients with major depression. Higher depression, severity of depression, higher level of these cytokines. And activation of immune system has been shown that induced mood changes. It's very similar to what we see in the depression, like anhedonia, anorexia, and social withdrawal. And psychological stress can increase the level of cortisol and inflammatory cytokine. And it has been shown that in inflammatory markers, cytokines, also chemokines, and CRP, acute phase proteins, are increased in psychiatric condition. And different studies showed that, like in this study, sorry, I moved fast. I think it doesn't show that. Some studies show that CRP is elevated in patients with depression and psychiatric disorder, and more consensus that IL-6 is increased and TNF-alpha in these conditions. Then if we look at, if we look at what causes these psychiatric symptoms or mood changes in base of inflammation, there are a few mechanisms that could be involved. One is we need hypothalamus pituitary axis work or for coping with stress. When we have, it has been shown that when we administer TNF-alpha, we have elevated level of ACTH and cortisol in the serum. And when we have, on the opposite side, when we have increase in cytokine, we have also psychiatric, some mood changes or psychiatric changes. Then this chronic state of high level of inflammatory cytokine cause an insensitivity of corticotropin receptor hormones, and this insensitivity cause dysregulation of hypothalamus pituitary axis. And also in other studies, they have been proposed that there is a reduced neurogenesis. Peripheral cytokine can increase brain cytokine signaling, and increased neuroinflammation can increase breakdown of neurotransmitters such as serotonin, and oxidative stress can lead to changes in synaptic function and neurotransmitter metabolism. How peripheral inflammation affects brain? It has been proposed that inflammatory cytokine pass the blood-brain barrier, and then they activate macroglia, that is macrophages in brain cells, and then that's true that we have this regulation of immune system. Although we know that in a clinical trial, different biologics that target TNF or interleukins, they decrease significantly depressive symptoms and alleviate symptoms. They alleviate pain, and through that, and also they decrease inflammation in this patient. And also evidence showed that antidepressant medication, that they are targeting depression, they, such as serotonin reuptake inhibitor, they reduce the level of IL-6 and TNF-alpha. Then in conclusion, overall, it seems that there is a cycle between peripheral inflammation that we see and inflammation in the periphery and the influence that we have on brain and central inflammation. And these two are ending to the depressive symptom that we see in patients with inflammatory disorder. And the reviewed literature suggests that the rate of psychological comorbidities are very high in all three of these conditions, and anti-inflammatory pharmacological agents targeting the skin have shown effective in improving inflammatory symptom and quality of life of this patient. And cutting this inflammatory process can help to both sides. And literature on this topic related to HS is very limited.